Look closely at your skin, especially in the folds, your neck, armpits, groin. Do you notice any areas that look darker than the surrounding skin, maybe even feel a bit thick or velvety? Many people dismiss these patches as simple discoloration, maybe from sun exposure, friction, or even just needing a good scrub. They might think it's purely cosmetic, perhaps a bit embarrassing, but ultimately harmless. But what if that dark, velvety patch is actually a billboard? A warning sign your body is desperately trying to show you, signaling a serious underlying health storm brewing within. Ignoring this sign, thinking it's nothing, could lead you down a path where reversing the damage becomes incredibly difficult, maybe even impossible. Today, we're uncovering the truth about a common skin sign millions ignore, revealing why it could be a critical alert that demands your immediate attention before it's truly too late. The skin sign we're talking about is called Acanthosis Nigricans. Let's break that down. It typically appears as dark, hyperpigmented, thick, often velvety-feeling patches of skin. While it can technically appear anywhere, it has a strong preference for body folds and creases. The most common locations are the back and sides of the neck, the armpits, axillae, the groin area, and sometimes under the breasts or in abdominal folds. Less commonly, it might appear on knuckles, elbows, or knees. The color can range from light brown to very dark brown or almost black. The texture change is key. It often feels different, thicker, or like velvet or suede compared to the surrounding skin. It usually develops slowly over months or years. It's crucial to understand this isn't just dirt that can be washed off, nor is it typically contagious or caused by poor hygiene, despite common misconceptions. It's a manifestation of something happening inside your body. So, why does this darkening and thickening occur? In the vast majority of cases, Acanthosis nigricans is a visible sign of high insulin levels in the blood, a condition known as hyperinsulinemia. This is most commonly caused by insulin resistance. Let me explain simply. Insulin is a hormone that helps your cells absorb glucose, sugar, from your bloodstream for energy. When you have insulin resistance, your cells don't respond properly to insulin. Your pancreas tries to compensate by pumping out even more insulin. These excessively high levels of insulin can trigger skin cells in certain areas to reproduce rapidly, leading to the characteristic thickening and darkening of Acanthosis nigricans. Why is this so critical? Insulin resistance is the precursor to type 2 diabetes. That skin patch is essentially your body screaming, "My blood sugar regulation system is under serious stress." It's often one of the earliest visible signs, appearing long before other diabetes symptoms manifest. Ignoring it means ignoring a massive red flag for a potentially devastating chronic disease. While insulin resistance and impending or existing diabetes are by far the most common causes, especially in adults and overweight individuals, Acanthosis nigricans can occasionally be linked to other conditions. Polycystic ovary syndrome, PCOS, another condition often associated with insulin resistance, frequently presents with these skin changes. Certain hormonal disorders, like thyroid problems or adrenal gland issues, Cushing's syndrome, can also be culprits. Some medications, including hormonal contraceptives, corticosteroids, and high-dose niacin, might trigger it. More rarely, particularly if the onset is sudden, severe, or in unusual locations, like palms, soles, or mucous membranes, in an older adult, Acanthosis nigricans can be a warning sign of an internal malignancy, often a cancer in the stomach, liver, or other abdominal organ. This is less common, but it underscores why any new or changing skin sign like this warrants prompt medical evaluation to rule out serious underlying causes. Don't self-diagnose based on likelihood. Get it checked. Given its potential significance, why do so many people ignore Acanthosis nigricans? Several factors are at play. Firstly, as mentioned, many mistake it for poor hygiene or simple skin discoloration. There's often embarrassment associated with it, leading people to hide it rather than seek medical advice. Secondly, its gradual onset means people might get used to its appearance over time, normalizing it in their minds. Thirdly, there's often a lack of awareness. People simply don't know that this specific type of dark patch can signal serious health problems like diabetes. They haven't been educated to recognize it as a warning sign. Finally, there can be an element of denial. If the sign is associated with weight gain or potential diabetes, individuals might subconsciously avoid confronting the issue and seeking a diagnosis that could necessitate lifestyle changes. This combination of misinformation, embarrassment, normalization, and denial creates a dangerous blind spot. The phrase, "it might be too late," isn't just for dramatic effect. When Acanthosis nigricans is caused by insulin resistance, it's an early warning. Catching insulin resistance at this stage allows for intervention, often through diet, exercise, and weight management, that can potentially reverse the condition and prevent the progression to full-blown type 2 diabetes. Once diabetes develops and remains uncontrolled, it can lead to severe, irreversible complications: nerve damage, kidney failure, blindness, heart disease, stroke, amputations. Similarly, if the cause is a rarer but more sinister condition like cancer, early detection dramatically improves treatment outcomes and chances of survival. Ignoring the sign allows the underlying condition, whatever it may be, to progress unchecked, potentially reaching a point where treatment is less effective or the damage is already done. That skin patch isn't the disease itself, but it's a critical messenger. Listening to it early is key. If you notice dark, velvety patches consistent with Acanthosis Nigricans on your skin, or on the skin of a loved one, it's common in children and adolescents with obesity too. Don't panic, but don't ignore it. Schedule an appointment with your doctor or a dermatologist promptly. They can examine the patches, take a thorough medical history, including medications and family history, and determine the likely cause. They will likely order blood tests to check your blood sugar levels, insulin levels, and potentially other hormones or markers depending on their assessment. Be honest with your doctor about your lifestyle, diet, and any other symptoms you might be experiencing. Based on the diagnosis, they will recommend the appropriate course of action. If it's insulin resistance or prediabetes, this will likely involve significant lifestyle changes focused on diet and exercise. If another underlying condition is found, treatment will target that specific issue. The crucial first step is getting it evaluated by a professional. Your skin is an incredible organ, often reflecting your internal health in surprising ways. Acanthosis Nigricans, those dark, velvety patches, might seem like a minor cosmetic issue, but as we've uncovered, they are frequently a vital warning sign, most commonly pointing towards insulin resistance and the risk of type 2 diabetes, but also potentially other serious conditions. Ignoring this sign is like ignoring a smoke alarm. The consequences could be severe. Pay attention to your body. Regularly check your skin, especially in folds and creases. If you see something suspicious, don't dismiss it, don't delay. Seek professional medical advice immediately. Early detection and intervention can make all the difference in preventing long-term complications and protecting your health. Have you ever noticed this sign on yourself or someone you know? Share your experiences respectfully and without giving medical advice in the comments below. If you learned something important today, please give this video a thumbs up, subscribe for more vital health awareness content, and share it widely. You might thus help someone spot a warning sign before it's too late. Listen to your body. It might be trying to save your life.